Hello, everyone, and welcome to 1712's Community Information Session. Today, I'm here at Game Day in Catonsville with Dr. Muhammad, and we're going to touch on a few important facts in reference to men's health. But first of all, thank you for having me here and
Thank you for coming.
The 1712 podcast today. So, Dr. Muhammad, tell us a little bit about yourself.
So I'm a primary care physician. Basically, I work in a group practice in Frederick, Maryland. I have been in practice with this group for, since 2018. And before that, I worked in a rural setting in Southeast Kentucky for 5 years. And before that, I completed my training in family medicine at WVU, Morgantown, West Virginia.
Oh, wow. So, tell me a little bit about Game Day. What is Game Day?
So, Game Day is a men's health franchise. Basically, it's focused on men's health exclusively. We have 4 core products or services, if you may, that we offer. The first and foremost is basically testosterone replacement or TRT therapy.
Mm-hmm.
Number 2, we work with erectile dysfunction. We do offer treatments for erectile dysfunction. We also offer weight loss. Now, weight loss medications, GLP-1s that are out there, we offer for both men and women. And similarly, multivitamin and peptide therapy, which we offer for both men and women.
Wow. So, in other words, if it's like a one-stop shop for men's health.
Yes.
That's good. That's good. So, what made you choose Game Day over other franchises?
So, first of all, if you look at men's health, it's a very fractured space out there. You don't have a lot of brands out there with national presence.
Okay.
Game Day Men's Health, we have 200 plus locations all around in the US Open. It's one of the fastest growing franchises. And when I talked to Game Day and when I was in the onboarding process, I realized that the systems that they have in place and the quality of their work in terms of the information they provide, the trainings that we have to attend is second to none. So the protocols that we follow are regularly updated because they have a medical director who oversees and makes sure that all the latest information is available, provided to us, so we can provide that information to our patients.
Oh, that's good. So it's almost just like having a large support staff behind you.
Exactly, and that's very important when you are in a space like men's health, because there's a lot of evolution with current knowledge. There is old redundant knowledge which is out there, and unfortunately we don't have like a huge platform out there where we can discuss these things openly.
Well, that's great. Especially, this is something near and dear to my heart because, as you know, 1712, we deal with, orthopods and orthopedic devices. But we also deal in orthobiologics, which is PRP. And we're going to touch on a little bit of that. But I want to do a deeper dive into some of the services that you actually offer. One that's very attractive to me, and I know that a lot of men suffer from low testosterone. So tell me a little bit about the service that you offer there, and why should men look into TRT therapy?
Right. I think that's an excellent question. First and foremost, if you look at testosterone is just like, for men, it's just like how you have gas in the car. Without gas, the car is not going to work. So similarly, testosterone, which is basically an anabolic hormone, is very vital for men. Not only for their sexual health, but just their overall health. So for instance, it promotes muscle growth, muscle gain. It helps with brain fog. It helps with overall energy. And what a lot of people don't realize, testosterone is also very important for your cardiovascular health. There have been studies right now that do show that people who have low testosterone are at a high risk for cardiovascular effects,
Wow.
which is contrary to the belief that testosterone is associated with increased risk of cardiovascular outcomes. But if you look at the current studies, that has been refuted in multiple studies. And actually, there is a study where they checked testosterone levels in patients who had heart attacks and noted that all of them had low testosterone levels.
Wow. So we actually going to put the a couple of those studies in the bio at the bottom, so folks can do their own due diligence and read up on it. Also, so what is this stigma in reference to like testosterone and cancer or something like that? Because I know years ago a lot of folks were afraid of it. Have are there studies saying that hey, this is now safe, or there's no connection between the two? Could you elaborate on the safety of the testosterone as well,
Right.
when it comes to pancreatic
Yeah.
cancer?
Well, I mean, there have been, like these associations out there, but current literature, I haven't come across anything where there is an association between pancreatic cancer and testosterone. There is a concern, or let's say a caution, in patients who have had prostate cancer, which is um, one of the things that, if somebody is having prostate cancer or has a history of prostate cancer, we generally avoid using testosterone in them. Now, there is no association like a cause and effect, because all men have testosterone. So if we believe that there is a risk, or association between testosterone and prostate cancer, that means all men should end up having prostate cancer. But that does not happen. So there is no like cause and effect or causality. If I were to say that yes, testosterone, okay, it is associated with prostate cancer, as a precaution through our protocols or through guidelines, what we do is we avoid using testosterone in patients who have an active cancer or a history of prostate cancer, because testosterone is going to affect the prostate in terms of increase in the size, because it is a male organ, so it will kind of feed off of testosterone. But actually there are some interesting therapies which are being going on in Europe, where they are using testosterone to treat prostate cancer.
Wow.
Yes.
So but all this comes out during your due diligence when they come in for a consultation, correct?
Yes. So when people come in, our process through Game Day is that people come in, they're welcomed in our area. We have a very relaxed environment, because men, they tend to be very conservative and very shy when it comes to their sexual health. And men, we see just generally that men kind of tend to suffer in silence, because it's very hard for them to talk to somebody about all their symptoms. So we want to make sure they're relaxed. We have television, we have drinks, and all those things. So once people come in, they kind of feel relaxed. Once you're relaxed, you're more open to discuss what your problems are. Our next step is that we have our medical assistant who's going to take your vitals and briefly go over some of the things. And then we have a 30 to 40 minute talk with the provider over there, where we take a detailed history. We go into your medication list, your past problems, and then during this time we have already drawn your blood, and we are running your blood in-house. We look at your testosterone, your PSA levels, and we do a finger stick hemoglobin hematocrit to see what your levels are. Once we have those results, we can discuss with you what the plan is, and if you decide to proceed, the first dose that we agree upon, we give it to you in-house. And after that, we have a 6-week follow-up, and If your dose is stable, our minimum follow-up is 3 months. But the initial appointment, initial consultation is absolutely free, so people can come in, just see what we are doing, and if they like what we do, then we talk about other payment options.
Well, that's good. So let's say, so I'm assuming that, okay, I decide to go through with this. Do I come in and get a shot, or do I do it home? How does that work?
It all depends on what your preference is.
So I have a choice?
Yes.
Okay.
Of course. It's your preference. Some of our patients are very comfortable drawing the testosterone and giving a shot themselves. The shots are weekly or bi-weekly, depending on patients' choices. And when we are following testosterone, we want to make sure that they are maintaining their levels adequately. However, people who are not comfortable doing their shots, they can come in at the time of their shot, bring their own supplies, and we administer those shots, without charging any extra money or anything like that.
So one last thing before we move on to another product that you have that I'm extremely excited to talk about. Depression. Is depression linked with low testosterone?
Yes. People, actually, one of the symptoms of low testosterone could just be depression. And if you look at certain studies, there is a very strong association between depression and low testosterone. So I usually recommend anybody who is having depression like symptoms to make sure that their testosterone is tested first. It's very, very likely that once the low testosterone is treated, those depressive symptoms may go away.
Wow. So you hear this. Guys, if you're feeling sad, if you're feeling blue, get your blood work done. Find out where your levels are. So this next product, oh my gosh, I'm hearing so many great things about. It's called the Gains Wave.
Yes.
I heard this is a miracle worker. Let's talk to the audience about Gains Wave. What is Gains Wave?
So Gains Wave is basically a shockwave therapy. So shockwave therapy is high frequency ultrasound therapy.
Okay.
So the machine we have is actually called an OmniWave, and OmniWave is a top of the line product because the shock wave that it generates is a more focused beam as compared to a more radial beam. So if there's a focused beam, the focused beam is going to penetrate deeper into the tissue. What it does is there are multiple mechanisms of shockwave therapy, but it creates an environment where different growth factors that increase blood flow or enhance your blood flow, or various growth factors that basically dilate your blood vessels so there is more blood coming in, is a system that we achieve. The more blood flow you have, that tissue is going to heal much better. So we use this for musculoskeletal issues. For instance, someone is having, let's say, a heel pain or plantar fasciitis that is not responding well to traditional physical therapy. They are more than welcome to come in. We can try this treatment and see if that helps. So Gainswave or shockwave therapy is FDA approved for musculoskeletal issues.
But our hers is also used for ED, correct?
Exactly. There is an off-label use for ED as well. The good thing about OmniWave or the machine we have is it is painless. There is no invasive material or any injection that we are doing, and a lot of people just prefer not using that. And so far, there have been excellent results with patients using the Gainswave or shockwave therapy. That is, shockwave therapy, basically the idea is to generate or create an environment in that tissue where you have all these growth factors that migrate via blood, and they cause tissue healing. They increase blood flow, so all those blocked vessels for XYZ reasons which are present, they open up, causes more blood flow. More blood flow helps with ED. ED, if you look at ED, the basic pathology is for whatever reasons, underlying medical conditions, there is basically low blood flow. That the vascular is one of the bigger ones. Yes, there could be neurological causes as well, but they're kind of lower down on the list as compared to vascular. So our job when it comes to Gainswave or shockwave therapy is to create more blood flow.
Okay, makes sense. Break up that plaque there. So,
Exactly.
yeah. So, and the last service that I want to talk about is the HGH peptides. What is that, and how can men benefit from the HGH peptides?
So HGH peptides, basically the peptides that we use, basically they help release human growth hormone. Human growth hormone is like a very vital uh, um, uh, peptide that is released in our body. And if you look at the human growth hormone, there is a steady decline as we age. And a lot of times we have patients who come in and they're having symptoms of low testosterone, but when we check their testosterone, their numbers are actually pretty decent. The second thought is this could be low growth hormone because the symptoms are very similar: low energy, low sex drive, low mood, increased abdominal fat. So what we usually start off is with sermorelin. Sermorelin is a weak growth hormone releasing peptide. It is FDA class 1, basically FDA approved for certain medical conditions as well. So very safe. Of course, there are side effects which can happen with it, and we discuss those side effects. But from a safety point of view, it is category 1 by FDA. That means, you can use it without any concerns in terms of FDA safety.
Okay.
So really helps people who are going to the gym, who really want that who really want
To burn that fat.
to burn that
Yeah,
fat
yes,
down, and help with the fatigue, recovery from your workout. So if you recover in 40 minutes, people on sermorelin, they may recover in 20 minutes.
I've used this, by the way, and when I used to compete, and this is some great stuff.
This is some good
Yeah,
stuff.
some
Yes,
great stuff, some good
yes.
stuff.
And of course, if you look at peptides, there are a lot of peptides out there, but we focus on the ones that are category 1 as approved by FDA, which have been deemed to be safe.
So speaking of the gym, that was one thing that I wanted to go over and spend a little time with this. So again, as you know, one of my expertise is in orthobiologics. So we're talking PRP. And I heard that you have a treatment, okay, for PRP, for erectile dysfunction. So can we talk a little bit about that before we end the interview?
Of course. So platelet-rich plasma, the more we have studied, the more we have looked into it, we have realized that there has been a lot of interest in terms of usage for, as you were saying, joints. A lot of places are using that for hair growth, subcutaneous injections as well. And similarly, we have seen a lot of interest, a lot of focus when it comes to erectile dysfunction, where we are using platelet-rich plasma.
So I want to tell the audience who, if you're not familiar with PRP, stem cells. So just to simplify things a little bit, stem cells injections. So
Yes. So basically what we do is we draw your blood, about 30 cc's of blood. We spin the blood, so the top part of the blood will be around 15 cc, which will have the platelet rich portion in it. So it will have platelets, it will have stem cells, and growth factor cells as well. And what we do is we take that platelet rich plasma and we inject it into certain places of your penile tissue, and the treatment really helps enhance vascular flow because there are growth factors, as you were saying, stem cells as well, and because of the presence of those growth factors, there is increased blood flow, and that really helps with erectile dysfunction. And lately in our clinic, we have seen quite a lot of people come in who are very interested in this therapy.
Wow, wow. So listen, I want to thank you. And first of all, I want to reach out to all the men out there, especially if you're located in the Catonsville area. Stop by Game Day, ask for Dr. Muhammad, and just come in. And if you have any questions, you can reach out to me, W. Gatewood at 1712 devices.com. How can they reach you, Dr. Muhammad?
Well, I mean, they can reach us. Email me at mkhilji at gamedaymen'shealth.com, or they can just give our office a call, 410-402-5199, or they can always drop by our office, talk to our manager as well. 7001 Johnycake Rd, Suite 101, Windsor Mill, Maryland.
Great. And like I said, any questions coming to 1712, I will forward them personally to Dr. Muhammad. Again, I want to thank everyone for tuning in today. Hopefully you got something from this interview. And remember, men, if you're feeling down, if you're suffering from depression, if you have low energy, come on into the men's clinic. Like you said, the consultation is free. And let's just see if Dr. Muhammad and his wonderful staff can help you. Again, thank you on behalf of Game Day and 1712 Devices.
Thank you so much for having me.
You're welcome.